Hello, my name is John Zamora, and I'll be performing administration of intramuscular injection for my BSN 225 course at Nightingale College. Before we begin, we just want to make sure that we have the right supplies with me. So I have my patient, I have my needle. This one right here is a 22 to 25 gauge needle, 1 inch to 1.5 inch needle. I have my 3 milliliter syringe. I have my medication vial, which is morphine. I have my alcohol prep pads. I have my gauze, my gloves, my sharps my designated sharps container, and then hand sanitizer for hand hygiene. Before we begin, I will first check the provider's orders and the AHR, and I'm also going to verify the 6 rights of medication administration, which are the right patient, right drug, right route, right time, right dose, and right documentation. Then I will compare the medication to the MAR to the EHR to make sure I have the correct dose. And the order has stated morphine sulfate 4 milligrams per milliliter, but the provider's order says 6 milligrams of morphine to be injected 1 time for pain. We're gonna have to be doing a little bit of calculation. So the calculation we obtained was 1.5 milliliters to be administered to the patient. So that's gonna be my first safety check. Now that I've done these checks, I can now gather my supplies and enter the patient's room. I will knock, close the door and or curtain for patient privacy, and I'll perform hand hygiene, and then I will introduce myself to the patient using AIDIT. Hello, my name is John Zamora. I'm going to be your nurse today. We're going to be administering your morphine injection. It's only going to take a few minutes. Do you have any questions or concerns I may need to know about before you begin? Patient has stated no. There's no concerns. So is it okay if you can verify your name and date of birth, please? Name and date of birth has been verified with 2-step patient identifiers. I'm now going to ask to see if they have any allergies to food, medications, seasonal allergies that I should be aware about. At this time, the patient has stated no, so now we can proceed forward to continue. I will now perform hand hygiene and then put on clean gloves. Okay, so I'm now going to get my alcohol pad and clean the top of the vial and let it air dry. I'm gonna throw that in the trash receptacle. Okay. And while that air is drying, I'm gonna grab my syringe, and then I'm gonna grab the syringe and the needle, and then I'm gonna put that together. Okay. Now that it's attached, while the cap is still on, I am going to draw 1.5 milliliters of air. And now that that has been completed, I'm gonna remove the cap, and then I'm gonna place that down, and then I'm gonna inject it into the morphine sulfate. And then I'm gonna inject the air in. Once that has been completed, we're gonna flip the vial upside down, and then I'm now gonna draw 1.5 milliliters of morphine. I'm gonna go slightly off and then push back to get some of that air, and then push back. And just in case, I'm just gonna make sure that all the air bubbles are out. Okay. And doing the one-hand scoop, I'm gonna scoop the needle into here and close this, and then I'm gonna show y'all for a few seconds that I administered, or I've drawn 1.5 milliliters of morphine. Okay. Now that that has been done, for my second safety check, I will now make sure that I have the correct dose with the label to the MAR. And when I'm assessing that, I'm now gonna educate the patient on morphine and what it basically is. So I will tell the patient I'll be administering morphine and that it's used for pain. It acts on some of those pain receptors to reduce the perception of pain. And I will let them know that some of the common side effects include drowsiness and constipation. I will let them know about some of the adverse effects, which includes difficulty breathing or hives, which will signify an allergic reaction. And if they have any of these adverse effects happen, I'll ask for them to please let me know immediately. Also, as with most injections, they may feel a slight burning or tingling sensation at the injection site, but it should subside shortly. I'll ask again if they have any questions or concerns I may need to know about before I proceed forward. The patient says they do not, so I can proceed. So I'll continue with my third safety check, and I will verify that I have the correct dose in the syringe. So while I'm looking at the syringe, I'll compare it to the medication vial, and then I'll compare it to the MAR and to the patient's wristband or the patient's name to make sure that they're the same before we administer. Now I can move on to assessing for a proper injection site. So now we're gonna look at the patient. We're gonna have them lay on their right side, where their, I'm gonna have them lay on the left side where their right hip is facing towards me and exposed. Now we're going to locate the site using some anatomical landmarkers. So I'm gonna place my palm on the area near the greater trochanter, and I'll point the thumb towards the groin, and then I will use my pointer finger to be placed on top of the anterior superior iliac spine. Okay, and then my middle finger will be placed on top of the iliac crest. I'm going to make some space just to adjust just a little bit, and then I'm going to grab gauze. And with the V shape that I made with my finger and middle finger is where I will also administer the medication. So I'm gonna grab the gauze, or not the gauze, the alcohol pad. I'm gonna place it right here. I'm having it point down to the area I need to inject the morphine sulfate. And once that has been done, I will now, when I'm obscuring the spot, I will make sure there isn't any inflammation, blemishes, bruising, or wounds. I will also want to make sure that the muscle integrity is good and ready for an injection. We're also going to palpate to make sure that there's no tenderness or pain in the in that area. Doesn't seem to be. So once all of that is done, I can now clean the site with an alcohol pad. I'm just going to grab a new one, dispose of that in a designated reciprocal. And then now I'm going to use another alcohol pad, because the one we have right now is to show our anatomical landmark. I'm now going to clean the area, swiping from inner to outer, going 2 inches. I'm just going to place that right back there, and I'm going to dispose of that just to make sure just to make sure that I have it in the right spot that I had it before I removed it. Now I'm gonna leave that first alcohol pad, and it's pointing on the arrow at where I'm going to do the injection site at, where I'm gonna administer it into. I'm now gonna uncap the needle. I'm now gonna uncap the needle, and I'll place the ulnar side, where my hand up against the patient's skin and pull down that it's taunted or taut, and I will pinch the side with my pointer and thumb finger. Now I'm going to inject the needle about 90 degrees and going straight down. And then while I'm stabilizing the area, I'm gonna inject 10 seconds per milliliter all the way down. And then I'm gonna hold it here for about, I'd say 10 seconds, so. Okay, I'm now going to remove the needle slowly, and then I'm going to dispose of this in the designated Sharps reciprocal, and then I'm going to grab a clean gauge, and then I'm going to place it right on top of the area and add some slight pressure. Okay. I will make sure not to massage the site, and I will just double check to make sure that there's no bleeding or anything out of the ordinary. But right now, there doesn't seem to be any bleeding present, so we will not need to put a band-aid. But the site looks fine so far. So now that that is done, we're also now going to clean our area into the designated trash receptacle. Put this here. I'm going to put this back into the MAR. And then we're going to remove our gloves and perform hand hygiene. Okay. I will then make sure that I documented the procedure in the EHR, stating the medication, name, dose, time, route, site of administration, and the patient's response with any adverse reactions if it happens. I'm going to also thank the patient for their time. If they have any side effects or adverse effects, to let me know immediately. And then now I'm going to make sure that my patient is in an adequate, comfortable position. I'm gonna hand them their call light. Also ask again if they have any questions or concerns I may need to know about. If not, I'm gonna step out and document my findings. This shall conclude the end of my skills video for my administration of intramuscular injections for my BSN 225 course at Nightingale College. Thank you.